You can tell from the written application whether there's a bit of personality to it and what you're expecting. But the interview is really the time where you get to test some of that and see how authentically they come across compared to a resume and a cover letter. And referees are obviously good for that as well, because they'll confirm your impressions. But the top three things that I really look for is someone who really knows what the role is about and has taken time to understand that and to understand the organisation and how that fits in. Generally, if people have made an effort before the interview or before the application to either reach out and understand that, that's going to give them the best opportunity. And I look for passion. I look for authenticity, sorry. I look for good communication skills and, a bit of personality. But I also look for diversity. So I know I'm pretty good at what I do now, so I don't need a cookie cutter of me. I need someone who's going to challenge me and help me think a little bit differently as well, and also bring the skills to the role that I don't necessarily have. So I do also, and particularly as I've gotten more comfortable through my career, have started to look a little bit more for the candidates that I think are going to be complementary and bring something that maybe is not so much my strength, but something that would really add value to the team. I'm interviewing doctors here, so they've gotten through medical school, they've managed to apply themselves, they've managed to work successfully, and the majority of them will be high achievers who can do most of what from an intellectual perspective you're seeking of them. So I tend to look much more for the softer skills, which I think I love that term now of calling them the not soft skills, because I think they are the harder things. So how they interact personally, the teamwork skills. Passion is a big one that really I believe is really, really important. So I look for passion and authenticity and values. So I think it's really important to have someone who's aligned to the values of yourself and your team and the organisation and can work within that. I've actually probably hired a lot of doctors in non-clinical roles where this might be their first non-clinical role. And my experience has sort of taught me that will is a very big part of that. So you can assume most doctors have the skill and the intellect. So the attitude, how they treat people, empathy is really important, and a passion for what they do. And I've managed to train a lot of doctors who are newly in non-clinical roles on the basis of picking people with those elements.